Hi everybody, I'm Laurie Cadden, and we are here to do another edition, another series of Mind Body Wellness for the Lackawanna Luzerne County Medical Society. And I have the lovely Chris Fozzie with us, who's actually running this wonderful program. It's called Diabetes Prevention Program, very easy. Chris, we're going to interview in a little bit several people who have almost completed the program, those who are in it a little bit towards the end, and those then, because that sounded like the same thing, but they're almost, some are finished, some are almost finished, and then just beginning today, actually, which was so cute, because I'm thinking a couple days, it's just today. So tell everybody, if you could, tell me a little bit about the program, why it works, why the YMCA decided to do this. Obviously you see that it works because based on what you've been telling me, there's a lot that went on that's in a positive way. So tell everybody why.
So we basically started the program a few years ago, went and did the training. So a lot of the Ys were doing this, and so we went and got the training, and then we implemented it. And once we did that and started to see the results, which were so fantastic, we kept going with it. So we're always looking for grants to help move this forward, as many classes as we can get. This is actually, today is beginning our 7th class. And it starts off doing weekly sessions. So we do weekly sessions for 16 weeks, and then we do every other week for a few weeks, and then we do monthly for the last 6 months. So they wean off of, they learn how to just be able to do this and, you know, live their life with this new lifestyle, and it's really working.
And you said it's a year-long program, and that you usually have anywhere between 8 to 12, maybe up to 15, depending.
Right.
And how do, when you have a group that size, it's great because it is a smaller amount, but everybody and everything going on when it comes to this, you know, exercise and eating and the food and doing it right, and all the emotional baggage that comes along with all of these things. How has that been working? Because it becomes a sort of group therapy. So how has that all worked for you? Do you see positive results in all of that?
Yeah, absolutely. Just like one of the women, I'm sure she'll be telling you, she actually went from just basically staying at home to now coming to all the classes at the Y, volunteering at another place. So she's really come out of her shell, and also she's, you know, gotten much healthier. I think they form friendships. Some of the people actually get together and they meet each other outside of the program. And one of the people in one of the programs that's going to be finishing next month wants to start an alumni program where we get together and they see each other once a month with the whole group, all of the 7 sessions. Whoever wants to come can actually come and just be accountable to each other and say, this is what's going on, can you help me with this? And, you know, just to keep it going.
Well, you have to feel very proud of this. How long has this been now? How many years?
This has been 3.
3 years. So that has to make you feel good. You brought it, it's working, you get people, you're probably never at a loss for people to be part of it, are you?
Well, actually, I would love to see more.
Oh, really?
Yeah, it would be wonderful to have more people that were interested and more people actually helping us fund this so that we can get this out and really help more people.
Okay. So if you just call the YMCA, if that's something they're interested in. The other thing you said is a lot of the people are in the Silver Sneakers program, some of them aren't. It cuts all ages, which you said, which I like, that it touches a lot of different people. What would be the incentive for them to be here if they're not on a program that already has their membership paid? Anything? Is there any benefit to that? Is there any trial? You said 4 months, I think you said.
They get 4 months of free membership with the YMCA when they're part of this program, but they also get to just come in and be part of the YMCA and part of the YMCA family and meet a group of people that they have similar things in common with, and they form friendships and they become like a family.
And I have to say, Chris, this is the first time that I've ever been, and I can't stop saying how beautiful this place is. How old is this building? Do you know?
Oh, you know what? I don't know exactly the date, but if you go downstairs, and it'd be nice for you to do a little shot of it, you can see exactly down the one hallway that we came in, they have all the people from the past that, you know, all the years that they were.
I saw them when I was coming.
And that's really impressive. And then on the back wall, on the front wall on the side, there's the year actually that it was built. So it's amazing.
It's beautiful. It truly is. Anything else you'd like to tell everybody about the program?
I love the program. I think it works, and I'm very happy to be part of it. And, you know, come and call and try to be part of it yourself.
And one of the regulations you said, which I think is important, you cannot already be diagnosed with diabetes.
Right,
you have to have a pre-diabetic status, correct?
Yes, yes. You cannot be diabetic. It's a pre-diabetic status, and sadly, very many people are.
Yeah.
You just need to get the A1C check, and you'll find out.
And there's many things that you follow, and the guidelines that are available. It's a process, which is really good because it's not just come in. You really work with the people.
Yeah, each week, each session is different. Each session covers something different that we learn, and behavioral changes and lifestyle changes.
Okay, well, Chris, congratulations. Looking forward to interviewing all these ladies, and one gentleman I hear is in the group.
Yep.
One so far. Good, here we go.
And we've had a few men.
I
It's
know,
not
but
just
this
one,
one's just one. He's the lucky guy today. Okay, well, thank you very much. Ladies and gentlemen, this is Chris Fozzie, and Chris runs the, I want to make sure, diabetes prevention program here at the YMCA in Wilkes-Barre. So good luck. It continued last 3 years. Good, so keep going. Thank you very much. Okay, we're going to go speak to the group right now. Well, now, ladies and gentlemen, we're going to have the pleasure of meeting several participants in this wonderful, and I want to make sure we get it, diabetes prevention program. I'm saying it right because we have to make, this is so important for us to understand. As we just spoke to Chris, we're going to now speak to some of the participants who are going to tell you a little bit of what it's like they're almost completed or completed during the actual program, and those who just have started. So we just want to get a little feel for this year-long program that is beneficial to everybody, but the participants are you're going to learn a little bit more about them now. So I'm going to start over here to my far left to Mr. Jim Bardo. Jim has, he's one of the completed, he's almost completed. He's been doing a great job, as are all of you people in this room. I know it isn't easy to commit to anything, yet a year-long process. So Jim, I'm going to ask you a few questions if you don't mind answering, and see how you feel. When you first started the program, which, as you know, as we said, it's a year-long, you have to meet certain guidelines. What made you decide, hey, you know what, I think this is something I want to do, and I'm going to see if I can do it? What made you think, your first inclination was what?
That I was not going to start medication for prediabetes, that I felt that I could do this by diet alone, because I was under the care of a nutritionist before, and it was a little different. It was counting carbs as opposed to this program counting fat. So I thought that I could revert back to that and do it that way.
Jim, question, you know, with all the stuff out there, changes in this diet, and people say you shouldn't eat fat, eat more, don't eat sugar, don't eat this. If it is focused, this program focused on the fat, do you think that has been easier for you for the last year? Because you know what they are and they're easier to avoid, and there's healthier alternatives? Or where do you feel you fit in? What made you think you could do that?
It's a lifestyle change. It's not a diet. You could eat anything you want, but you have to count the fat. And you learn very quickly the foods that you have to avoid.
Yeah.
Because you are allowed only so many grams of fat per day. So your 3 meals and some snacks have to fit into that amount of fat grams.
And tell me about the exercise part of it.
I don't do as much exercise as I would like to,
Okay.
but exercise is an important part of your lifestyle change.
Do you think, Jim, that maybe, and I always think about this, if you can master one thing first, like the food element of this, then maybe ease into the exercise and other things that maybe is a little more, because let's face it, when we say we have to exercise, it's just something else we have to fit into our day, whether we're retired or not. It's another element of what we have to do. And not everybody's doing cartwheels saying, oh, I want to work out. We have people like that, but we also have people who just know they need to do it, so they do it. So do you think, now that you've mastered the food end of things, maybe that will be your next thing? Because you look like you're in pretty good shape to me.
Well, thank you.
I'm winking at you too, Jim.
It is tough, like you said, with your schedules and everything fitting your daily routine to fit that in, but it has to be done.
It has to be done. All right. And then when you've have you seen progress made with your numbers based on seeing your physician during this year?
Yes, I have. I've lost 30 pounds, and my A1C went from 6.4 to 6.0. And when I went back to the nutritionist, she was extremely happy that that was done just by diet.
Wow, good for you.
Without medication.
Well, hats off to you, Jim. Really, you look great. Can you pass that over to our friend? We're going to have Rosalyn
Marachko.
Marachko. See? Marachko. Rosalyn Marachko. She also is about the same time as Jim. She's going to tell us a little bit about how she feels having almost completed this one-year program. So Rosalyn, same kind of thing for Jim. What made you feel, I can do this?
Well, I had been coming to the Y religiously 6 days a week for a year, and with the intention to lose weight. And I do like to exercise besides that. I like group classes. But I didn't lose an ounce, and I didn't know why. And I saw someone else who regularly went to our exercise classes who lost an amazing amount of weight. And I asked what she did, and then I tried to see whether I, qualified for the program. And I loved the program. I mean, I can't tell you how wonderful it was. Chris, our instructor, is non-judgmental. It wasn't so rigorous that you hated to come. Actually liked coming here. And for the first time in my life, I found the secret to weight loss.
And how do your doctors like where you've come in almost
Well,
a year?
actually, when I went to the doctor, they weighed me and asked what was going on. Do I feel okay? Because I had been habitually overweight. So I told them about the program, and I'm very pleased.
So you're one of those people, and I think what we should have done when she said I'm a person. So let's do it, would you, with me? Give her a round of applause for liking exercise. Because that's a good thing. And here we are at this incredible, it's beautiful, this building, this YMCA. I mean, what a privilege to be here. It's unbelievable. So you like to come, you did it, you made these changes. When you're in the group, do you also find that is there a component of sort of a group, almost, I want to say therapy for lack of a better term? Do you kind of feel that you hear everybody's struggles or triumphs, and everyone shares that, so that gives you a little more encouragement?
Absolutely. And people bring recipes that they've tried that go along with the program. Yes, that is support. You're not the only one in the game. Mm-hmm. And actually, when you could see your progress weekly at first, it helps a lot.
Okay,
Helps
good. Well,
tremendously.
we also have a few people. Thank you very much,
You're
Rosalyn.
welcome.
Very, very, very informative. It's wonderful to see the progress. Again, not knowing them before, but knowing how proud you seem and how happy you to continue. Again, a year-long program is a very long time, so good for you guys. So now we have a few ladies who are here. And did you know, Jim, you're the only, beside Mark, our handsome camera guy, our expert, you're the only guy in the room.
I was the only guy in our class.
Was that part of your motivation, Jim?
No.
Okay, good. But, there's an old line, blessed art thou among women, Jim. You got it. You're good. Okay, so we're going to talk to a few ladies. We have Bernadine Brown, Sharon Long, and Laura McGreary. They're all here. We're going to talk a little bit to them and see. We're going to start with Bernadine and see how she made out and what she thinks. So Bernadine, similar to your right and left friends there,
Yes.
tell me a little bit about what made you think, you know what, I think I can get this done.
Well, I worked with Rosalyn,
Okay.
and we work in a department that there's always food, always food. And I was standing in the room one day, and I said, "Oh my God, I don't know what I'm doing. I just can't stop eating." And Rosalyn called from the other room, and she said, she said very sweetly, there is a program that I come in contact with, and she said, it's been helping me. So I said, from there, I got myself hooked up with the Y and began the program. And it really is a lifesaver because I will confess to being a food addict. Mm-hmm. That's my drug of choice, food. And with this program, there's the accountability. There are tools. You have the it's the program. The basis of it is in your head. And even though I'm not strictly on track with it now, it is really a very, very excellent program. I thought I would mind jotting everything down, but it's not a chore at all.
And you eat, fruit is a good thing. Do I see strawberries on your ears? Are they? How
Yes.
about it? Check that out, Mark. I love it, strawberries. She's living, she's wearing the program too, strawberries. I love them, they're so pretty. But
Thank
that's
you.
great. So doing it, and regardless of what, it stays in your mind, even if you're not 100% all the time, you get back to it and it stays ever present
Yes.
from what you've learned throughout the
Yes.
year.
You know that it works, and it can work if you stick to it. But one of the other things that happened from this is that I came in contact with the why in the classes here, the exercise. And then I went to, further from that, to volunteering somewhere. So it kind of opened a couch potato up and in a good way.
So you're moving in other ways that you didn't think you
Right.
would. Even if it is something that it always isn't the focus of food,
Yes.
you're moving in other ways that's going to help you in the long run.
Absolutely.
And how do your physicians feel about your progress?
Well, I had my A1C before I started the program, and they usually do it once a year. But when I went to the cardiologist and he was dictating the letter to my physician, he looked at me and said, well, he said she's down 12 pounds. So anyway, it does work. And I think I met my goal, Chris. Did I meet my goal?
Yep.
Or maybe 1 pound from it, but
There you go.
anyway, so
Well, congratulations.
thank you so much.
And next up, we're going to talk to Sharon Long. Hi, Sharon.
Hello.
How are you?
I'm good. How
Sharon,
are
now, are
you?
you nervous? Because we had enough ladies and one lucky guy that we've been talking to. Isn't it easy? It's like you're talking to someone in the hallway.
Sure.
Except we're sitting in a room with the camera in your face. It's really okay.
Right.
Ladies, I'm getting you all when we're finished. No, I'm teasing. No, I'm teasing. I love it. It's your first day. No, thank you. I'm not, I promise. We're just going to take a picture.
I did take an interview a long time ago with the heart program, that
Well-
when I was, she told me, so I prepared, I'm not
Yeah,
prepared today.
but Mark, see, for not being prepared, and you look pretty in that purple too, by the way. There you
I'm
go.
not prepared.
All right,
Let
but
them work for it, let them do it. My
I
turn
love it.
will
See, I picked on the right one. See, we always can. Sharon, tell me a little bit about your decision, because it's always good to hear everybody's perspective. Okay, a year long, I can do it, I can't do it, maybe I can, maybe. What made you finally take the leap?
Well, before I did this program, I had breast cancer, and I was in the Live Strong program with Chris. She was the one that kind of got me into all of this. And she suggested, my life was way out of whack, believe me. And she suggested to come into this program since my blood sugar was high, everything was off. My blood pressure was high, everything was off. So I started this program after the Live Strong program, and I lost 20 pounds. And it's just been, as far as even a support system, it's wonderful. We've made friends. Our group actually has a group text message that we send around to each other. We stay in touch. Sometimes we get together and do walks together. So it's been a real support system for me. And Chris is a wonderful, wonderful support on her own, let alone a teacher. She's really great. I can't say enough about her in many ways. So that's basically my story, and the program works. And there are times when, you can fall off a bit, and you come in and you talk to everybody, and everybody has the same experience, but we get back up and we get back on with the encouragement of other people and keep going.
Well, do you think, Sharon, too, that, and I don't know this firsthand, but I know from talking to friends who have gone through breast cancer, the medications that you take can really throw off a lot of your own body with your blood work and everything else, because they're so strong and it's trying to, help you move beyond that. So they can do that. And I think a lot of times, sometimes people think, well, I've gotten through breast cancer. That was a feat in and of itself, and now I have to deal with this. Look, I'm a survivor. I'm okay. I'm going to be where I am. So I guess it goes to show that even though you do and you are in that phase, moving on to something a little different in another way can make you look at things in a whole other light, because here you are after battling breast cancer, now you lost 20 pounds on a program that was totally opposite, totally different than what you were just focused on.
Absolutely.
Yeah.
And it's another, as Bernie said, it's another facet of life and of moving, of exercise. We had a great exercise program. I utilized the Y for that, the membership for that. And in my numbers, my blood pressure medication was lowered. My blood sugar is normal now. So, I mean, there have been a lot of changes my doctor has been very happy about, and so am I.
Well, congratulations on
Thank you.
both ends. That's
Yes.
wonderful. Good for you.
Yeah.
And can you pass that on over to our last friend on the during part, because we had beginning, during, and completed, which are friend Jim and the girls over there. So we have the lovely Laura McGreary. Laura, tell us a little bit, as I said to everyone else, so we keep it consistent. Why did you think you could do this program?
Well, I wanted to do something to help me lose weight. I have 2 children, and with both pregnancies, I had gestational diabetes.
Okay.
So it was always in the back of my mind that I was going to get diabetes, or, it runs in my family as well. So it's something that I've always been thinking about. My mother-in-law joined the Y, and she had seen the flyers, and she said, was this something that you would be interested in? And she's actually in the class with me. So we came, and it's been great. It's been great for me. I've lost weight. I feel good. I have energy. I've learned so much, just eating healthier, making better choices, actually eating your meals, like not skipping meals was a big thing for me, It's just helped me a lot.
So the nice thing that I see with this is that it's all age groups coming together. And now, as Sharon's saying, a group text where everybody sees how you're doing, how you're progressing, if you have a friend and you need it. That's really a neat way to look at things too, I'm sure, Laura. To come into this, did you say your mother-in-law or your mother?
My mother-in-law.
Your mother-in-law. So to do it and do it with her and to have that kind of support, and then all these other people, it's really nice to know that there's other people out there who struggle, who are looking for the right thing to do, and are looking for someone who understands. Because we all can say, yeah, we get it. But when you're going through it, I think that group effect is so much more important and so much healthier to continue, because you're supporting each other along the way. I'm sure you see a lot of that. And how old are your children?
9 and 7.
So do they see a change in your you're probably
I have
moving
more
more?
energy.
Yeah.
I work out more, have more energy. We do a lot more outdoor things together. And I'm just so happy that I was able to take this class, at my age now, so that I learn, how to take care of myself.
Do you kind of think what we were talking about earlier and what we said with Bernadine, the fact that she may not always do it, but it's sort of always in the front of your mind, even at this stage? How long are you in the program now?
We're almost done with the program.
Okay, so yeah, it's been kind of, okay, this is what it is for a year.
Right.
So
Right.
it's amazing. I think it's wonderful. So
It is wonderful.
good luck and congratulations to all of you who are either there or almost there. Keep up the good work. The finish line is close. And then we're going to speak with another lovely lady, because we're going to talk to her. She's just beginning this program. How about me? I'm talking to Laura. So she's just beginning the program. Mark, don't ever let me forget what you know. And we're going to talk to her and see why she decided. So we have the lovely Betty Ann Hughes with us, who is one of the ladies at the table who said, I'll do it. And everyone was jumping up, and I had to decide who I wanted to give it to, because they were all volunteering. Chris, I think this program has made these people TV stars, because they all wanted in, but I chose Betty Ann. Betty Ann Hughes, what do you think about, you can look at me and occasionally look over there, so it looks like you and I are having a conversation. You sure you don't want to be in on this? Okay. All right, so Betty Ann, you're just beginning.
Uh-huh.
So what was it for you that said, I'm going to do this too?
I am right at the cutoff from pre-diabetes to diabetes.
Okay.
And I was shocked. My blood sugar was just up a little, but my doctor ran an A1C test, and when I saw that, it was a wake-up call, because
Yeah.
I am afraid of diabetes. It sneaks up on you and can affect so many organs in your body. And I know I have to lose weight. Exercise is not a problem. I'm a member here. My job, I get between 5,000 and 7,000 steps in 5.5 hours.
Wow, that's great.
It's just the eating part that I need to focus on, eating right.
And so far, what are you learning?
Well, today, this is the
Oh,
first
this is your
class.
first day?
Yeah, it's my first class.
Okay, well, so what did you learn from here now? Betty Ann, we learned. We talked to all these people. You guys are really brand spanking new. Why did I think they were in it a little bit at least? Well,
Yeah,
man, here you are.
Yeah.
Oh, well, are you a little nervous at all? I mean, the
Somewhat.
holidays are around the corner. What happens?
Yeah.
And that's, I'm going to ask someone to give me that.
Yeah.
What do you think you'll do during that holiday time?
I think I will cut down on the amount of cookies that I make.
Okay.
I don't think I will buy as much candy for Christmas.
So eat in moderation,
Yes, yes,
as best you can.
yes. yes.
And what do you hope in the long run, when this is a year from now, and we come back here and say, okay, Betty Ann, it's a year, how'd you do? What do you want to tell me?
That I lost weight and that I learned how to eat right. Like I said, I have the exercise down. I'm active. But I notice, it's tough going up and down steps. I have about more weight on me than I should have. So,
Well, I wish you a lot of luck. I'm
Thank
sure you're
you.
going to do well, as the rest of these, everybody else, including this one right here. So, good luck to you.
Thank
Can
you.
you pass that down? Because I'm going to talk to one of the, I want to know, I'm going to ask anybody who wants to jump in. The holidays are approaching, okay? What your best way of looking at this? Yeah, Jim. Let's get Jim again. Jim, I mean, let's face it, it's easier, we're all women beside you and Mark, it's easier as a guy to lose weight, right, ladies? Men just do it easier. Chris, you can even attest to it. It just comes off a whole lot easier. And it's mostly because, this is the line, is because women's bodies we're what's the word I'm looking? We're predisposed, because we're supposed to have babies, and we keep fat for that because of childbearing, and it never goes away, even though the childbearing years are behind. It stays. I say to people all the time, you know what? I have extra weight. I just had a baby 25 years ago. That's my line, and I'm sticking to it. So, Jim, tell me, what do you do when it comes to stuff? Do you, in your mind, as we talked about, Bernadine said it's always there. Is it always there? Do you let yourself go a little bit and then jump back on? Or do you not even think about it and you just keep focused on how you've been?
It's always there in your mind. Your lifestyle change tells you what you can and what you can't have. And when the holidays come up, believe it or not, at Christmas I had one piece of my sister-in-law's homemade nut roll. And it fit into my 42 grams because I was saving for it. So, I had one piece at Christmas, and that was great. And
Do you have a little butter on it?
No butter.
Just plain nut roll?
Just plain nut roll. And that when you look at how much fat's in plain
I
nut
could
roll.
imagine, yeah. But
So-
the nuts are high, right?
Yes, nuts are very high. And, but it's always on your mind, and you can cheat once in a while, and there's nothing wrong with that. But you can't cheat every day, because then that's the slippery slope.
Right.
You have to jump right back on your food plan.
Well,
So-
I'm very impressed with all of you people here today. I think it's been very informative. Do you think maybe I might come back and visit you, Betty Ann? And I'm going to say, and then maybe this one will talk to, what's your name?
Patricia.
Patricia. Maybe she'll have been scripted enough to be on.
Yeah, maybe next time.
Mark, put her down, Patricia, next time. Well, thank you very much, everybody. And like I said, did you know you were on camera? Except when Mark got in your face. Here's what Mark said earlier. I have to tell you, if I get close to you, don't mind. It's just the camera. So he did okay. But thank you very much.
Thank you.
Thank you to you too, Chris. Thanks to the YMCA of Wilkes-Barre, and we will hopefully be back and see how you all made out. So thank you again for watching, everybody. I'm Laurie Catton. Thanks for watching.